For the donut pad, first you have to get a foam pad, cut out the edges. Once you cut out the square, make a little circle shape with it. The size will just vary depending on the size of the callus or blister you're trying to cover up in the foot. Next thing you do is cut out the center. Completing that donut shaped. In the video it just shows a simple foam pad. It has no adhesive. Sometimes they stick to them. Now you complete a donut pad. Place it on the foot, see if it measures up right. Using Powerflex or a sticky type of tape, cover it up. And it should be good to go. Now, first you gotta spray on for this loop arch tape job. Let it dry off. Apply a little anchor strip right at the base of the toes. And you will start from the little toe, go inside around the heel, come up and finish at the little toe again. Same thing. Go towards the outside of the heel, starting from the big toe and at big toe. And this step will be repeated 2 to 3 times, and you'll overlap every time by about 1/3 of the width of the tape. Each time going from little toe to big toe until you get this nice crossover of the loops. See how they start to cross over? Every time you want to get good tension, that way the arch is nice and firm. Once that is done, add 1.5 inch to close it up. That'll just give it some extra support too. You can cover up using C-strips, which is basically just going across the bottom of the foot. Cutting it out. And there you go. Now for an ankle wrap, this would happen post ankle injury. You would add a horseshoe onto the lateral side if it's on the lateral side or on the outside of the ankle. Wrap it up with an elastic bandage. So you want to cover as much of the ankle as you can. Try to put the most tension on the foot, and as you're coming up, just ease up on the tension. That way blood flow and swelling can just flow up and not get stuck on the foot. To close up, you can use tape. Some use clips, but tape can last longer. Now this will be a close basket weave. You apply your heel and lace pads, pre-wrap on. This just makes it comfortable for the patient. So you apply it, try to cover up as much of the area as possible. When using pre-wrap, always go with the flow of the tape. If you go against it, it'll wrinkle up and it's a mess. Apply 2 anchors at the top. That's near the base of the calf. Once that is done, you go from inside to outside around the heel. Cross those anchors. And then we have the C-strips going from inside bone to outside bone, the ankle. Repeat. And it'll give you that nice basket weave. Close out with the last C-strip. Once that is done, you can start closing it up. This is all to prevent lateral ankle sprain, or most common ankle sprains are like that. Now we go into the heel locks. You want to come up and hug the heel when you're doing this. If you go a little bit below your ankle bone, you can get a pretty nice angle and it'll look really clean.
Smooth.
Now for added support, we can use a subtalar tilt. Start at the pinky, angle it down towards the heel, and come up and finish right above that little hinge where your foot will come up and down. Usually you'll use some elastic tape for this, so Elasticon is pretty good. And it's very good extra support. Second strip will be about the same, only opposite, starting on the big toe. Come from behind the heel, up and across, cut it up. Should be nice. There you go. Now for an Achilles tape job, you want to have your patient lay on their stomach, have their foot relaxed the whole time, add 2 anchors at the base of the calf. You add another anchor with a bit of power flex around the foot. Then you'll use stretch tape, measure from bottom of the foot up to the calf. Make sure you get some good amount of length into that, because once you split it, it will be a little shorter. So here you split it. Go ahead and place the side that is not split on the foot. Get some tension in there. You can split the tape, adjust to the anchors, and now we can repeat that either 2 or 3 more times to make a total of 4 or 3, depending on your preference or the patient's preference on how much support they want for that Achilles tendon. You also don't want to add too much tension, because then they won't be able to point their toes up. We're gonna go with 3 here on this video. This will be the last strip. Make sure they overlap. Anchor it up again, just to clean up. 4 strips. And then add more power flex to the bottom again to anchor that up, clean it up nice. There you go. Thumb spica, you want to have your patient with their hand outstretched like that. Come across, down.
No anchor?
Not necessarily at the wrist, but a little bit above it. You're going to want to cross that first noticeable joint of your thumb. And this is a continuous thumb spica. As you can see, if you notice closely, they all overlap, giving more support. That should do the trick.